is a fast evolving sector where global trends force health organizations to adapt quickly their business model. India is at the crossroads of an exciting and challenging period in its history. Healthcare providers are starting to innovate their business models in order to respond to new trends. The next generation business models are more focused towards technology and artificial intelligence uniqueness, patient-centeredness, and value addition. This session focuses on the next generation business models and how these models are helping redefining healthcare delivery.
Let me introduce the anchor for the session, Dr. Venkat Sudigali, Director and COO, Excell Hospital, Hyderabad. He is the Business Development Consultant at Niramay Health Analytics. Sir is the Chief Executive Officer at Equitable Healthcare Access Consortium. Dr. Venkat has worked more than 17 years in UK and is one of the few doctors in the world with dual Royal qualification, that is, Royal College of Pediatrics and Royal College of Radiologists, London, UK. He is the first ever ambassador of the Royal College of Radiologists, UK. Now, I request Dr. Venkat Sudigali to come onto the dais and introduce the panelists for the session.
It's a great pleasure to be here, and I thank Symbiosis and all the organizers for inviting me. Wonderful to see all the audience, medical students, eminent doctors, healthcare professionals in this group. Great pleasure to invite the rest of the panelists, so I'll introduce the other panelists first and then introduce myself. So, can I welcome Dr. Bishwajit Nayak, please, on the stage. Dr. Nayak is Head Claims and Networking in SBI General Insurance in Pune. He was a Senior Vice President, Health Claims and Networking, Future Generali India Insurance Company Limited, Pune. Dr. Nayak was Assistant Vice President, Health Claims, Bajaj Alliance General Insurance, and also Health Claims in Bajaj Alliance General Insurance in Pune. Awarded CEO Excellence Award by Bajaj Alliance for setting up the largest in-house hospital network, and winner of the Great Managers Award 2020 by Economic Times and People Business. So please give him a big hand. On the stage, who is Head of International Business, Wallace Pharmaceuticals in Mumbai, Assistant General Manager, Flamingo, and Pharmaceuticals Product Manager, Leva Healthcare. Dr. Aparna also received the Member of Leaders Excellence at Harvard Square. Did her PhD Business Administration Marketing in Pharma Industry and MBA Marketing Institute of Management Studies. So welcome, Dr. Aparna. Please give a big hand. And next, can I invite Mr. Pathan Arshad Khan, who is the Head Lab Operations Maharashtra Goa and Chief of Lab for Thane at Dr. Lal Path Labs Limited. Dr. Khan worked as a pathologist at KB Baba Hospital, Bandra, from August 2011 to July 12, and at SRL Limited, Goregaon, and Histopath, worked with SRL Limited at Fortis, Hiranandani Hospital, Vashi, and faced NABL assessment and final audit. Closely worked on RT-PCR lab for COVID testing at Mumbai and Pune lab as well. Please welcome. And thank you for introducing myself. So I'm Dr. Venkat, and I'm a radiologist by profession, and I do a lot of scans, and I use technology and AI in my day-to-day practice. So we report scans from all over the world, UK, US, Australia, etc. So great pleasure to be here. So this is a panel discussion. So what I would like to do is to talk with everybody in a very informal setting and go through some of the questions and discussions, and maybe after 45 minutes, we'll open up for the audience for some more questions. Okay, so first I would like to invite Dr. Khan to just give a brief background about his own work, his own business, and can you just inform what business model that you're currently having and what do you see in the next few years?
Hello. Good morning, everyone. So I am Dr. Arshad Khan. I am head for lab operations for Dr. Lal Path Labs. So basically, Dr. Lal Path Lab Limited is a listed company, and we are primarily into pathology business. So I am taking care of Maharashtra, Goa business with respect to lab operations. So at this moment of time, we are having close to 20 plus labs in Maharashtra and Goa. And our operation is hub and spoke model. So we have a lab at a location, and we receive samples from collection centers, PSCs, hospitals, and home collections. And then there is also patients that are directly walking into the labs. So this is the kind of model we are following. We are very much into automation, and we use automation in each and every aspect of laboratory business, whether it be pre-analytical, analytical, or post-analytical phase. We are very much into the automation. Uh, we use AI for analysis of patient data, and we use lot of data for uh, uh, launching new packages and new tests that are available worldwide. So we are also into that. So that's what all we are doing right now. And we are also in starting genomics, and there we have also opened up in last 2 years close to 20 PCR laboratories as well. 3 PCR laboratories we have opened in Maharashtra itself. So this is the kind of business we are doing in Maharashtra, Goa, and also pan India. So lot of focus is on automation.
Thank you. So I would like to start off by asking a very uh, common question. Let us address the elephant in the room. Now, everybody talks about AI in healthcare, but do you really think that it benefits a patient? That's the first question. In your own specific field. Also, do you think it adds to the cost? Because we are using so much of technology which is very expensive, at least at this stage. And patients are already in our country facing a lot of burden with payments and all. So, are you justifying that we are using AI technology and increasing the cost to the patient? What do you think about that?
So I don't think the using AI increases the cost to the patient, because being a very large laboratory and having very large amount of workload as well. So we have lot of patients, and due to that amount of patient, and India being a very populous country, what we have is the biggest thing that we have is data, and we are just analyzing that data. And because we have a very large amount of data, large amount of patient, the cost gets very much diluted. So we have done an internal analysis कि how the automation can decrease. In fact, it doesn't increase the cost, it decreases the cost. So in most of our bigger labs, we have almost 10, 15 labs that are of very high volumes, getting 2,000 to 3,000 patients. So we have decreased the manpower in this lab, and we have gone for, at some places, total lab automation, at some places, semi-partial lab automation, and we have, in our most of the labs, we have a integrated instruments. So it doesn't, AI and automation doesn't increase cost to the patient. In fact, it decreases the cost to the patient.
Thank you. So you're rightly saying that it may increase the investment part for the investors or your group, but later on you can absorb the cost and it will be more cost effective in the long run.
Yes, sir.
Yeah, thank you. I'll bring in Dr. Nayak at this stage. Dr. Nayak, the insurance industry has been rapidly evolving over the past few years compared to maybe a few decades ago. Now, with COVID, we have new technology, including telemedicine. People are happy to do OPD consultations on mobile phones or digital platforms. With this kind of newer approach which the healthcare system is facing, do you have any business models that you can describe which is going to be ready for the future, especially with regards to telemedicine uptake, which we are seeing in the country?
Yeah, good morning, everyone. So, with COVID, yes, for the health insurance industry, I feel the best thing that has happened is the awareness for health insurance, for which we have been struggling. I think insurance companies have been struggling for a long time to bring that awareness in society that why insurance is important. I think COVID has helped the industry in that way, that people now realize with the kind of expenses, with the kind of out-of-pocket expenditure that happens, that why it is important to have that basic insurance for yourself, just like you have a motor insurance or a home insurance. Unfortunately, over the last, since insurance got privatized in, say, 2001, uh, penetration is still below 10%. And that's unfortunate for a country where we talk about bringing in economic security for the households. With COVID, yes, as you rightly said, the circumstances forced people to adopt newer forms of treatment, so newer forms of consultation. The healthcare industry adapted to it rapidly. The population also had no choice, but if you wanted healthcare, you have to talk to a doctor remotely using virtual options. And that also has actually helped insurance companies to devise products in a way where you could reduce your overall what we call as insurance claim costs, because now people would be more open to probably seeking an outpatient consultation before you go in for a inpatient kind of treatment. So earlier it was very easy that if I have a fever, I walk into the hospital, meet a specialist, and unfortunately in some business practices that leads from an OPD to an IPD automatically, and then the cost for the claims also rises. But with these kind of business models where you tell the person that yes, you can first seek an OPD consultation, you have a primary consultant who advises whether you need specialist opinion, whether you need inpatient treatment as such, and then only you go for it. So yes, on a business model front, we now see more insurance products evolving around the outpatient part, whereas earlier it was more around the inpatient part of it.
So now we have EICU, for example. So just as an example, I'm telling you, how do you think that the insurance industry is going to cover those aspects? Are they people going and visiting one particular area to ensure that there is no frauds or verifying records? That's all, old school of doing the business. But now with all this technology coming up, do you think it's going to make the insurance claims process very easy in the next few decades?
Yeah, so unfortunately, the form of health insurance that has existed in the country has not evolved at the same pace at which I would say the healthcare industry has evolved. Insurance products have been traditionally towards sickness insurance, where it is, if a person falls sick, do we start triggering in the insurance chain. But yes, now insurers are open to it, obviously, because you have more foreign insurers who are investing in the Indian insurance industry, models from the US and the other developed markets coming in. And although maybe in the short term, as Dr. Khan was talking about the investment in the short term for insurers, it could be an investment in the short term. But looking at the kind of long-term benefits that could come out of it, I think insurers are now opening up to invest more in technology, as well as the take care of the technology which the healthcare industry is bringing in, starting from EICUs, a big revolution happening on the home care front, where insurers are now open to covering things like dialysis and chemotherapy is happening even in a domiciliary setup kind of thing, as well as starting to bring in preventive and primary health care. So yes, that's something which we are seeing coming up.
Sure, I'll come back to use of technology in insurance care, where I'll try to put you in the spot. But let us go on to Dr. Aparna next. Dr. Aparna, your role is predominantly has been in exports. Can you tell me a bit about your experience during the COVID times, where obviously all the shipments, all the communications, everything had a paradigm shift, and people could hardly travel. All the shipments, was cut off for a period of time. Then communications was again a problem. Any innovative ideas that you had during that time, which you can see that they are sustainable in the long run as well?
Yeah. Good morning, everyone. Indeed, a pleasure to be a part of SYMHEALTH 2022. And yeah, thanks to the organizer for such a fantastic arrangement and for the relevant topics for discussion. Yeah, exports majorly concerns into regulatory. If you have to differentiate exports from domestic, in export, regulatory plays a major role. So what we did is, we focused more of our energy during this pandemic time on the regulatory side, wherein preparing of dossiers, working on new products, so that we don't waste time, because regulatory takes time in exports. On the marketing and sales side, what we did is we went digital. Like, yeah, our representatives started talking to the doctors on WhatsApp. We had webinars. Yeah, we understand that many companies had gotten into digital through webinars, but how we differentiated is we chose topics like which will enthuse the doctors, like medico-legal topics, or topics like financial investment plannings. So that will enthuse the doctor, and doctor will come on webinars. So that's how we went digital. Apart from that, this pandemic actually did not affected those products which were already established in the markets. Yeah, our new products launches got delayed, but our products which were already established and which were already on the pen of the doctors, they were not harmed. So yeah, launches took, and we delayed some launches, but yes, we even took the risk of launching some of the product like tofacitinib, and that product has, yeah, it has given us good results. So yeah, we had gone online, webinars, all those stuff we had gone into. Yeah.
Thank you. Now, question to Dr. Nayak. Mr. Nayak, sorry, Mr. Khan. Mr. Khan, we talked about using AI in your own organization, and we talked about a little bit about the pros and cons. But let us talk about the business model as such. And to simplify it, in a broad sense, we try to reduce the cost and increase the revenue in any business model. But with all the things that we are talking about, including the impact of COVID, use of technology and all, how do you ensure the quality remains the same or even improves in the long run with use of technology in the new generation models that we are thinking about? Do you have any models that you're already trying out? If so, what is your experience on those?
We are already into it. We are basically we are using AIs and all those things for that. So with respect to COVID, when COVID was there, there was a tremendous pressures on the lab. It was very huge pressure to generate RT-PCR report, and at such a large space that was not possible for most of the lab. And it was not due to the processing. We could process maybe 5,000, 10,000 samples in the day, but to capture data of the patients, it was very difficult. So we needed to improvise. So we had to, because there was in each and every state there was different rules, different regulations. So most of the places, the common thing was RT-PCR app, for which each and every case had to be registered in the RT-PCR app. So during that time, we made our own app that got patched with RT-PCR app, and we just needed to put SRF ID. So all that data that is of the patient, it gets captured into our system, and we can process the sample. So that way, by using technology, we reduced lots of work, because previously in first wave, we had to hire 15, 20 people for such kind of work. That got reduced to 1 or 2 people due to just use of this single app. That is the first part of the question. So that reduces the cost, and it increases the efficacy, and the turnaround time also improved. Second, when the samples are coming in such a large number, so software allows us to auto validate the things. So how does that? It uses delta check. Say whether all the previous data is available. So we have all the data. So if the previous data is available and the values are matching us with the previous data, it can be auto released. It doesn't need to go to the doctor. So software comes in there, and it really helps in. So suppose there are 5,000 samples, 2,000 samples will get auto released, and only the doctor needs to be employed for 3,000 samples, and that again increases the cost efficacy of the system. So that's how we are doing it, and most other players are also doing the similar way.
And how often do you do an audit to check whether this process is working fine?
So basically, it's a very simple process. It's a software based process. So whenever we set up an instrument, whenever there is a new lab, so we audit all the SIMs, what is going in and what is coming out. So that needs to be checked, and all the data, because it gets captured. Whenever there is an error, it gets flagged by the system itself. Okay, it is violating delta check. So then we can say whether there is some error, or the clinical condition of the patient has deteriorated or improved. So that way it is done.
So in other words, when you have or when you propose a next generation business model, very important to consider what kind of quality checks you have.
Yes.
And, because unless the quality is sustainable and very high in the long run, your whatever technology you may implement and whatever business model that you can develop may not be successful.
So, coming to that, with respect to quality, now the instrument have got so smart. You can feed in the instrument. After this many samples, you again put a control. Okay, whether system is working properly or not. So, no need of involvement of any person. Whether he sometimes due to high workload, the technician might forget to put QC in the evening, but instrument doesn't forget, software doesn't forget. So what it does after 8 hours, it again puts the QC, and QC is on board only. So it puts the QC. If the some QC is out, it blocks that test. So it cannot be reported to the patient. So for all those things, software and artificial intelligence comes into the play, and more it is evolving, and it is giving newer insights into the business.
Thank you. Very, very useful and very insightful. So next we are going to talk with Dr. Nayak again. It's a very broad question that I have, and maybe some of the audience also have the same thinking. But India is such a big nation, 1.5 billion, and it's a huge potential market for the health insurance industry. And traditionally, as you said, the uptake for private healthcare insurance has been very low in India. Although the potential is still high, especially in the working population, where probably the awareness and the need for them to go and obtain an insurance is not seen from their vision. Can you describe anything that you are doing in your organization which can address this problem? Because it is a huge market to be captured, not just business-wise, but also to improve, a chance to improve the nation's health quality and improve the productivity in the long run as well. Any thoughts, any ideas that you can share with us in the long run for everybody?
So one of the reasons for the low uptake, as I said, one is awareness. The second is about the insurers not wanting to move into the semi-urban or the towns and cities or the rural areas as such. One about the acquisition cost, the cost of setting up a office over there or infrastructure over there. Second, again, the availability of the internet connectivity or other things at those places. But that, I think, has changed in the last few years with technology actually reaching the common service centers that the government has started setting up at those places. For our organization, SBI General Insurance, fortunately, because we have a large bank distribution, and you would find an SBI bank in the third tier of the country, also third tier city of the country. We use that network for distributing our insurance products, because if you can reach that last mile over there and start selling the insurance policy even to a Jandhan bank account holder over there, and it could be the most basic insurance policy. It need not be something which is loaded as a corporate insurance kind of thing, because finally, there are two kinds of insurance which actually are there existing in the market. One is the fully loaded, the corporate insurers where corporate employees are trying to do something. What actually is needed at the basic level is what takes care of the primary healthcare over there, and maybe the secondary level kind of thing. Tertiary, for that class, the government today has opened up if you look at the mass healthcare schemes which are there, like the Ayushman Bharat scheme which is there. So that partnership which has now started developing between the private and the public sector thing, where the private sector insurers are taking care of the healthcare financing and involving the public sector healthcare delivery in delivering that healthcare treatment, that is slowly working out. And if you see the kind of spread which has happened probably between 2010, 11 till now, most of the rural healthcare population now does have access to some form of insurance. It may not be a very high sum insured, but at least to a 50,000 or to a 1 lakh kind of insurance cover that's there. That has purely come through the reach of technology to that last mile. And secondly, distribution. I think that was always because insurance traditionally has depended on agents. So you have a person who used to physically distribute insurance as such. That has its own challenges in terms of how much of information actually reaches. Insurance, one of the main pain points is about transparency of the, how much the person knows the terms and conditions. And insurers are, usually they are, the acquisition is that at the time of a claim, you bring up terms and conditions. The person doesn't know when he's buying it. So that, I think, has improved to a certain extent, where now you involve people at the self-help group levels in the villages. They themselves are the people who understand the product first and then sell it to the people over there. So you have the risk actually being distributed, or the risk being understood by the population who is buying insurance. Earlier it was a one-sided push product. Now you have people understanding that product and buying it. So yes, probably in the next few years, you would have a much better insurance uptake in those areas.
And one of the reasons for people not reading claims is that they are too fine print. And for somebody like me who wears glasses, we can hardly see. We have to use the magnifying glass.
Agreed. And that's, I think, the most, that's an area of which many insurers are now working on simplifying the terms. And as I said, it is traditionally has been in a way where, it's written in a certain, so 1980s when the product was formed, and there were certain things which were put in. There was an inertia to actually modify that till you had privatization. But now you would find insurance companies actually bringing it down to a level where probably a school-going student also reads that and simpler. The other challenge to it is also from the viewpoint that it's a regulated industry. So you have to have certain standardized norms, a certain standardized nomenclature which is there. But yeah, the industry is working towards it, and I do accept that has been a pain point for the industry. Yeah.
Thank you. We'll move on to Dr. Aparna next. Dr. Aparna, we talked about next generation pharma business models and the export and the impact which COVID had on the innovative challenges that we all faced. Let's talk about digital pharmacy. Now we are seeing some companies, some startups doing a B2C kind of setup where their prescriptions are being ordered online, their medicines are being delivered online. In the bigger pharma industry, do you think that you can really sustain that kind of business model in the long run, where you can talk to your partners and your customers and your doctors in a very digital fashion, where they perhaps order bulk drugs online, check inventory online, these kind of models? Can you just enlighten us in any way?
Yeah, according to me, next gen business model will be more of a collaborative approach, because the pandemic has shown us the example of Oxford and AstraZeneca vaccine. If AstraZeneca would have been alone to develop this vaccine, it would have taken years to develop. But because of this collaboration, that academia industry collaboration, we got that vaccine within 9 to 10 months, which was very fast. So now the challenge is for every company, pharma companies which have their own patents and all, challenge is to shorten the time to market. So collaborating with companies, collaborating with R&D houses, and then getting it automized, like artificial intelligence in research and development, so that time to market gets shortened. So before the patent expires, the new molecule is there in the market, so that the company doesn't loses its revenue. Now, moving forward, companies have already started going digitalized in all the functions of a pharma company, that different functions, important functions like production, R&D, marketing and sales. They are getting in touch with all those software companies for the effective digital solutions, for cost effectiveness, for getting the market fast, for a better outcomes like patient convenience, a better patient experience. All this, so every company is getting digitalized. And yes, I feel that this is definitely going to help. And this is definitely going to help every company. And so collaboration is the key, according to me. and companies which have already started going digitalized. So many of the software companies like Siemens and Apple, they have already predicted by 2027, the pharma picture will be, the pharma will be completely digitalized. It will be a pharma integrated company, digitalized company. So yes, this is definitely going to help, digitalization.
I think even the regulatory part has changed to accommodate for the digitalization of the pharma world.
Yeah.
In the pandemic, some FDA, US
Yeah,
FDA, for
yeah,
example,
yeah.
they did digital
Yeah,
assessment.
yeah. Now, what no, as far as US FDA and Europe is concerned, they have gone digitalized years back. It was like from 2010 or so. All those dossiers and documentations that are required to register any product has to be uploaded on site. There's a site that they have created. All the documents for registration of any product has to be uploaded on that site. So it's already there, a portal is there. So yeah, here I would like to emphasize, so in case of export, as I said, regulatory plays a very important role. So if any company is aiming to get into export, it has to keep a timeline of 2.5 to 3 years, because it's unlike domestic, wherein it takes around 6 to 7 months, maybe 8 months or so, to commercialize any product, a generic product which is already established. A company usually copies the patent once it goes off patent, and then they keep the product on stability. After 6 months of stability, that product can be launched in the market with DCGI approval. But in exports, if you have to commercialize any product in exports, you have to first get your plant audited by the regulatory authority of that country. Once your plant is clear, then you have to file a dossier for the products which you want to register over there. Only after registration, you can commercialize that product in that market. So registration usually takes from 6 months to 2 years. It depends on the quality of your products. So if a company is aiming to get into export, it has to keep minimum 2.5 to 3 years of timeline to get into exports. Yeah.
Thank you. Thanks a lot. So moving on, Mr. Khan, we are both from diagnostic industry. I'm a radiologist. I also have a radiology company. And it's a very fundamental question which I always keep asking with my colleagues just to know what the idea is. So traditionally, the Indian healthcare system has been no primary care or very minimal primary care. Then we have the big centers, corporate hospitals, and a few government hospitals. There are a few government-based PHCs. But if you're talking about the main urban centers where the market actually is there's hardly any primary care at all. And diagnostic centers have come up because there were not enough tertiary care hospitals catering to either a population or a locality, right? But now there are more and more hospitals coming up, especially in the urban centers. Do you think a self-sustained, self-standing diagnostic centers is going to be a business model which can sustain in the long run, in the sense that major hospitals also have their own diagnostic equipment, their own pathologist, radiologist, everybody in the hospital itself? So in the long run, do you think having a standalone diagnostic centers where you always keep looking for referrals to your centers can sustain in the long run?
So basically, diagnostic industry is also evolving. So diagnostic industry is also not only in urban, it is going into semi-urban, even in tier 3 cities. We have lab at places like Bhandara, Solapur, Kolhapur, Sangli, Satara. We have labs in this location and that are doing pretty well. Again, there are many hospitals. I think there will be, each and every hospitals will be having certain kind of pathological setups. But still the requirement for a lab is always there for expertise, because usually in hospital they have a very basic kind of a test menu. 90-95% of hospital, they just have a very basic kind of test menu. And all the specialized, even semi-specialized tests, they need to send to somebody. So maybe if the lab setup is at a very smaller level, they could struggle. But for a fully automated and for a lab with a medium setup as well, which was doing semi-specialized, specialized, like doing hormones, cancer markers. And these tests are also getting generated at tremendous speed. And molecular tests and genetics, paragenetic, histopathology. There are so many branches that have come up. So the labs are concentrating on, now the labs have started concentrating on specialized, semi-specialized, and the tests are also getting generated of this test, and the infrastructure and the cost involved in setting up this test is also decreased. So suppose the hospital is doing a very kind of basic test menu, he needs a partner to get associated with the partner to do this kind of test. So it is getting tackled that way. And second thing is, we are also moving into, even now we have moved to tier 3 cities as well. So and even in some rural areas with AI automations. So we have our MD Dr. Lal has a dream to set up at least 5,000 lab in this kind of a rural setup. So we are working on it. We have developed a platform in which quality can be monitored from a remote location. So we are already doing it on all our 200 labs. So suppose if the QC is out at a lab, maybe at a Pune lab, it gets reflected to me. Okay, this QC is out and this person should not run the samples. And an automated mail gets generated. This QC is out, and you need to take corrective action, and you don't need to run sample. If he runs a sample, even a single sample, so it again a mail comes that you have run samples during a period of gap. There was no QC run on the proper, and the whole system gets activated. So by using this automation, AI and technology, and if with government regulations, if it allows, the lab will move into rural areas as well with this.
So I was going to ask you the next question. I mean, I quite correctly agree with you that many hospitals don't have the setup required for more complex tests. Maybe they can have a basic laboratory. But do you think the model is slowly moving towards tier 2, tier 3 cities where you have more diagnostic centers and maybe basic hospital adjacent to that? But in the urban areas where you already have these big corporate hospitals with full-fledged labs, the importance or the business model for a standalone diagnostic center is getting less, and you need to just shift your concentration to more to the tier 2, tier 3 cities?
It's a dual kind of a thing. We try to set up a center in a pure urban like Pune, Mumbai. The center will be highly specialized. So it not only caters to the local population and hospitals and all, it also caters to the samples that are coming from rural areas. So that way, the productivity of that lab increases, and we moreover get more samples in these labs. At most of our lab, our basic tests are not CBCs, not sugar. It is thyroid. We are getting 250 thyroids, maybe 100 sugars. So in most of our lab, even in sort of a rural setup, it will be 100 sugar and 100 thyroid. So it works for us for in that way that we have an urban center who have a specialized menu, semi-specialized menu. Then this urban center reports to a center maybe at a reference lab at Mumbai, Delhi. So we have that genetics, histopath. So it is all connected. All the smaller centers, they will come into Mumbai or Pune, and then Mumbai and Pune, whatever testing is not done, it goes to Delhi, and if whatever testing is not done, it goes to Mayo.
So the networking aspect is quite important, which you highlighted.
Yes.
Thank you. Thanks very much. Now moving on, Mr. Nayak, I have a very important question, and in fact, this is a question which is very close to my heart. And I think, generally speaking, insurance in any nation can make a big impact on the healthcare of the mass population. And you have got the power to improve the nation's healthcare, right? Now, within this audience, we are all learned people. Let us give a show of hands. How many actually have got health insurance? Can you just raise your hands, please?
I think after pandemic, everybody has got. After pandemic.
Okay, how many took insurance after COVID rather than before?
Oh, wow. Oh, there's one person.
Okay,
over there.
that's a bit of a surprise. And I think general thinking is that after COVID, people realized the importance of healthcare and took the insurance. But what is interesting is that many younger crowd within the group, students or the younger population, they seem to have insurance also. So slowly the realization has been coming across. And that brings me to a point where I can ask you a question regarding what the insurance companies can do with regards to primary and preventative healthcare in India. Because if you just go back a few decades, the healthcare system in India has basically started with the big corporates coming in or the government hospitals where there was not much of an infrastructure. And obviously the corporates invested heavily into their infrastructure, including big scanners and all. But no investment at all in primary care, right? Now, when I worked in a nation like UK, where the whole health insurance system is being sponsored by the government, so it's taxpayers' money. So actually the government in the UK builds parks so that people go walk, because that's an incentive for the government not to pay if they end up in the hospital with a major. So can insurance companies within India think about such incentives, especially to the younger crowd, or going and talking with the corporate companies like Microsoft, etc., where people sit on their desk for 8 hours non-stop and spoil their health? Can they actually go and incentivize, saying that, look, if you do this amount of exercise per week, you'll have reduced premiums, because that's going to be beneficial for the employee and the employer as well, because the productivity will increase. And of course, the insurance companies don't have to pay out big bills. Any thoughts on that?
Yeah, so I'll answer this in two parts. One on the primary healthcare reach to the rural part. So the insurance industry since 2001 is a highly regulated one, where the government wherever the government wants insurance to reach to the masses or to the villages and rural areas, it gets it done through the regulator, where the regulator mandates that, like for us, we have to have a certain portion of a premium coming from rural areas, and that's mandated. So by mandate, yes, insurance companies have to go there and sell insurance. Also, insurance companies are required to adopt certain districts. So if you look at the Northeast, or maybe the areas which are the less developed areas, insurance companies are required to adopt a district, spread awareness over there, set up an office over there, and probably also try to increase the kind of health insurance penetration there. On the other hand, when we look at the healthcare provider side, since there is not much of what I would say a strict regulation kind of thing, there is a choice whether I want to set it up in the urban areas where I do have the people who can pay for that, instead of going to the rural areas. And that's why if you see, traditionally it's the model of PHCs and CHCs existing over there. And then when you have those tertiary cares, you have the people sitting in the urban areas, and you have to come there for that kind of a treatment. So although insurance is slowly reaching over there, parallelly it's required that healthcare also reaches those areas. Yes, there are the mobile centers which are set up, and people having the camps and other things to probably screen the population and bringing it over. But still, the on-the-spot delivery on the healthcare side also needs to parallelly match, so that it goes hand in hand. On the corporate insurance side, which you touched up, that is interesting, because corporates, I feel, have invested in insurance in a way more, not from a productivity viewpoint, but it has been traditionally used as a perk for retention, right? So whether as a corporate I give my employee 100,000 cover vis-a-vis a 500,000 cover is what makes the employee decide which corporate I should join. And so it has always been a part of the HR budget in terms of, so health insurance is dealt in the way you give a Sodexo pass to the employee, right? So you say that this is your budget, and the way today corporates seek health insurance is that it's not of how much my outgo is for health insurance, but I have a fixed budget, this is my budget, and I want everything within this. And that traditionally harms the kind of benefit that goes to the employee. Now coming to incentivizing healthy lifestyle, that has already started, and you would see that most health insurance companies now have products which actually incentivize if you have a certain kind of, if you lead a healthy lifestyle, although it may not be at the level of what's happening in the developed nations, but there has been a start we have seen health insurance companies now offering the kind of tying up with the companies which offer pedometers or the smartwatches, and the data is connected to the health insurance company, where if you are able to show that you have been leading a healthy lifestyle, you get a discount in your premium, or you are given a higher sum insured, where your sum insured gets enhanced. So that has started. There are much more innovations coming in that space, but yes, the issue is also linked to some kind of data privacy, where the customer needs to be open to share data. I think that's also one point which is coming up as a challenge for insurance companies, of how many people are open to share that kind of data. But in the, I would say in the urban areas, that has seen a great change. We have a lot of uptake of people wanting to buy those kind of products, where they want to reduce their premiums by exhibiting a healthy lifestyle, and that I think is progressing on the right path right now.
Thank you. And ideally, I would like to see some kind of data sharing or partnerships between insurance and diagnostics, because if you have any patient who has got early diagnosis of a cancer, for example, you know, treatment is better, patient gets benefit, plus you don't have to pay big bills for radiotherapy or surgery in the future. Have you got any thoughts on that? Have you got any tie-ups with any insurance companies where you encourage their customers to come to you for early diagnosis, for example?
So we have a couple of tie-ups. So basically in that, usually when the patient, or not a patient, when a customer is taking a policy, at that time they get a health checkup done for that. That is the only basic minimum tie-up.
That has been the basic,
Basic.
crux of the insurance and the thing
But
since a
I
long
think
time.
it's a high time now. Insurance should incorporate diagnostics as well. Diagnostic tests
Absolutely.
should be covered in the insurance. So that actually saves lot of costs. So if the diagnostic tests are covered and patient, because now what patients are doing, they are very smart. They get admitted in the hospital, then do all the diagnostic tests. Maybe they are normal, and then there can be any kind of a malpractice as well. So if the diagnostic tests are covered, they can do radiological and pathological tests beforehand, and insurance company will be also be well informed that this kind of situation can come, and this is the situation of the patient. So that should be covered not at IPD but also at OPD basis.
Yeah, thank you. Just moving on, Dr. Aparna, we talked about yesterday when we are having a coffee together, we talked about inventory management, and because Symbiosis has got a very nice management institute, and that's a very hot topic for many of the students. So with the pandemic, you know, everything was up in the air, and it did a paradigm shift to how we normally manage inventory. And with your case, pharma, it's going to be like millions and millions of drugs probably either in stock or, you know, out of stock. So extremes. Did you face any of that challenge? And if so, have you got any newer technology, you know, blockchain or AI that can manage inventory at the press of a button, for example?
As I had mentioned earlier, collaboration is the key. So what companies have done, that they have collaborated with those software companies for the effective software solutions. So pharma companies have tied up with some software companies for a software solution. For example, my company has tied up with a company for software for a solution called Connect. Wherein with this Connect, my company, the supply chain is directly connected with the C&F. Every companies have C&F across the country. Every company has at least one CNF in each state. So this CNF is directly connected to the company's supply chain. So the distribution of the company, the distribution part of the company, they get direct information of the stock level at that CNF. CNF, you can say, is like a warehouse of the company for that state. So as it's directly connected, the company is directly able to visualize or to check the stock level at that C&F. So whenever that helps the company to sales forecast, that helps the company to plan their production accordingly. So because of this automation, company did not had any problem during the pandemic, because we had a clear picture of the stock levels at the stockist or at the C&F, and so accordingly we planned our production. So yes, automation and this digitalization has definitely helped the supply chain of the company.
Very interesting,
Yeah.
very interesting.
Yeah.
Unfortunately, we don't have time. We can actually speak all day on this topic.
Yeah.
But from the limited few minutes I have, I just want to ask Mr. Nayak a very interesting question. Um, blockchain technology is something very high tech at the moment, and many youngsters are very much interested. So basically, in the healthcare insurance industry, where patients' records are probably the most important aspect of claims, payouts, billing, electronic records, and so on. Are there any companies at the moment that you're aware of, or even your organization, which uses this kind of blockchain technology, for example, to verify patients' records, for preventing frauds, to talk to others in a very secured way, other organizations, where the patient had a scan, for example? Any thoughts on that? Any ideas?
So yeah, blockchain for health insurance, I think it's has a lot of potential, and so some usage has started on it. One area where it is used, we are using it is for our contracting with the providers. So your contracting terms, the smart contracts that you have with the providers, that helps you to bring in the claims, health insurance claims seamlessly, and then you don't need those physical assessments to happen, because you get the contractual terms over there, and the claims can be a straight through process. So your entire process of having the claim pass through different channels, and the pain area which usually is there, that you have a month time for a person's claims to be assessed, with that kind of a smart contract, we actually have the claims flowing seamlessly. On the underwriting side, where you do the risk management, yes, as Dr. Khan was speaking about, there's a potential there where the tests and other things which are done over there, and the patient records are created. If at every stage, starting from what the patient is doing on an annual basis, if he is undergoing an annual health checkup, and finally ends up with a claim at some point, the blockchain can actually help you get that kind of information over the years seamlessly, without disturbing the privacy, or letting the records go through many eyes, or the files being seen by too many people. You at least have that kind of a secure access to it. And the third place where blockchain is being used now is also on health insurance frauds, because 15% of our overall in the industry, the claims are where you have some kind of ethical issues in terms of whether a treatment has actually taken place, or whether when the policy was brought by the person who was actually existing or not existing. So they're trying to get the records of the person through that kind of at the underwriting level, and also to verify hospitals records on that. So you can actually verify the medical records of whether the treatment had actually been given, what kind of treatment was given, and what has been reflected in a discharge summary. So yes, on the fraud part, the risk management part, blockchain is something which I would not say is being used to its full potential, but it is picking up. Yeah.
Did you say 50 or 15%? 15%.
1 5.
Okay, still very significant.
It is significant.
And costs a lot of manpower,
Yeah.
resources to.
Yeah.
Right. Thank you very much. So let us open some questions for the crowd, because they have been quite silent and listening to all of us patiently. Sir, let us take your question first.
I'm Dr. Zamkar. I'm distinguished professor with SIU. My question is to Arshad. When the whole future of medicine is transferring towards precision medicine, what your company and labs are doing for developing NGS-based technologies?
Can we have the mic closer, please?
NGS-based technologies and say precision medicine, because the whole cancer management, whole thing is maybe another decade, we'll shift it to precision medicine. So what efforts you are doing?
As a company, we have made a division for it. We have completely made a division for it. We call it as genomics, and the brand name is GeneX karke. That we have done. So all those kind of technology, NGS, all those kind of technology are covered under that, and we are trying to promote it. At this moment of time, because the technology is fairly new and we don't have that kind of expertise, we are doing it through third party. We are trying to build an in-house capability for doing it. And the moment the volume increases, because the whole game is of volume. The moment the volume increases of this kind of thing, the cost will decrease and acceptability will also increase with time. So we are at this moment of time, it is more so in sort of what we call as a marketing phase. So only quite a few doctors are prescribing it, and we are getting it done. Whatever prescriptions we are getting it done through our partners. Some kind of testing we are also doing, but it is at very nascent stage. The moment the volumes increases, the acceptability in the market increases, we have developed a division and we have earmarked certain investment for that. And moment that is done, maybe you can see more and more tests being launched, maybe at monthly basis from right now. Yes, we offer that. We offer that. Certain profiles we are doing it ourselves. Certain profile we are getting it through the partners.
Yeah, like a foundation one,
Yes.
or is it available in India now?
Yes. It is available in India.
And what is the cost?
Cost, cost will be, it ranges, it's around 25,000 and above.
25,000 good enough, na? They were paying $5,000, and in US everything is covered by insurance.
Yes.
That's why there is a large volume. I
So
think insurance companies
the
should take into
lowest cost that
consideration.
is coming is around 25,000. Certain panels get 48,000, 60,000. There is panels like can assist breast. It costs around 45,000. So there are multiple panels, and moment the acceptability increases, the cost will definitely go. And India will be the first country in which the cost will decrease.
No. Insurance sector should take into consideration that if you want to pay.
That's the reason
for
why
the
I said
future-
they should talk to each other more
talk to
often.
each other. No, the problem with Indian insurance is malpractices. We are reasonably dishonest. And therefore, the feasibility of economics of insurance is always a great question. So why don't you introduce something like admissible deductions like they do in US? That first $500 you have to pay, and you have to pay beyond that, something like that.
No, that can be done, but there are ways to cover that first $500 also. So we would not get into those complications, but deductibles. So as you rightly said, our challenge is the regulation on the other side, right? So if that industry is not fully regulated, who controls the kind of tariff or the kind of billing happening on that side? If we introduce something where the first 500 rupees is to be paid, you will easily get a bill made of 500 rupees additional. So that is the other thing. But I agree on the part that we need to be more open on the kind of new things which are happening. The insurance would surely cover something which prevents the risk at a long-term stage. At the same time, as you rightly said, we need to have volumes for that. And one of the greatest another thing is about the hype about AI and ML, which we talk about in the healthcare industry and even insurance. That, as Sir rightly was pointing out, that healthcare is about human touch. How much of that human touch you replace with artificial intelligence is that balance that is to be brought in. If everything becomes artificial in healthcare, finally you would not, in the pandemic we realized that more than the innovations of pharma and the vaccines, it was the nursing care which actually did wonders in the recovery rates that were there. So insurance industry would pay for, consider those things. We'll have to see how much of that volumes are available at the larger stage. And as I said, that insurance companies are now much more liberal in bringing those up. And the regulator is also now quite liberal in approving products which involve technology as such.
I would like to highlight that point where you said in the pandemic, the most importance was given to nurses, the cleaners and the sanitizers, because they were all like working behind the screen, whereas the doctors and insurance, and no matter how much technology we have, they can't be replaced. So big round of applause for all the staff. With this, I would like to end. Maybe just one question, ma'am, please.
I'm Dr. Meeta Shah. I'm a histopathologist from Mumbai. This is question for Mr. Nayak. Now, in the recent years, we've heard of insurance portability. Has insurance portability led to better delivering of claims or clearance of claims? Because there is always a risk that the customer will go away to another company.
Yes, at least it has made insurance companies more conscious in what services, the timelines for the services which are there. Uh, uh, I would say portability has actually given a choice to customers now to, choose a company of their own. Earlier, it was that if you have been insured with a certain company, you would lose benefits when you move from one to other. Today, the insurance companies are on their toes that if I don't deliver that service, I would lose that customer. Yes, not to a significant extent because the price also matters. Because if you want a better product or you want a better service, there are insurance companies which actually charge for that. But surely on the distribution side, the agents as well as the people who are on the front line, that has made them conscious for sure.
Thank you, all the panelists, for such a wonderful discussion. Now, I request Dr. Venkat Sudigali to felicitate all our panelists.
Now, I request Dr. Sri Krishna Dali sir to felicitate Dr. Venkat Sudigali.